Well, Tiger Woods is going to be recovering from this devastating car accident. He is stable. Most importantly, he is alive. But his leg, specifically his right leg, according to the release that Tiger put out himself on Twitter, sustained major injuries. And to help us, maybe learn what his recovery could look like, we're very pleased to be joined by Dr. Seidenstein. He's a hip and knee replacement surgeon, works with trauma and leg injuries at Rothman Orthopaedics. He's also the chief of orthopedic surgery at Holy Name Medical Center and is the attending physician at Hackensack University Medical Center. Dr. Seidenstein, thanks so much for joining us today. How are you?
I'm doing well, Maggie. Thank you for having me.
No, it's our pleasure. And so when you first heard of Tiger's accident and now the injuries that he sustained, what was your first thought?
Well, obviously, we're all happy to hear that Tiger's life was never in any danger, and he's doing well from that standpoint. But obviously, these are very concerning and serious injuries that he suffered, and got the appropriate emergent care right away out there in Los Angeles.
Doc, what is the process here now and the timeline for recovery from the injuries that he suffered?
Well, I'm just going by the reports that we've heard through the media and through Tiger, as is everyone else. Obviously, I don't know the specific condition more so than that in regards to what he's dealing with. But Tiger suffered open comminuted fractures. Let me describe what that actually means. Comminution means this wasn't a clean break. His bone is in several pieces. Open meaning that the bones from the inside out punctured the skin. And the reason why he was treated emergently is to make sure that he didn't get any type of infection from any debris that could have been in the area of the accident. So he had these injuries washed out. He had the injuries, the fractures treated with different types of fixation. And then the fractures themselves were caused by a high-energy mechanism such as this car accident, and so the tissues became very swollen, and they had to do releases of the tissues around these areas. This all means that this is probably not the only operation he is going to have, meaning that sometimes these patients go back for second, even third times to the operating room for further washouts, again, to prevent infection. Also, to close the releases that they did of these soft tissues once the soft tissue swelling goes down considerably and it's safe to do so. So just from a surgical standpoint, he may not be completely out of the woods. Outside of that, the bones themselves can take anywhere from 2 to 3 months to fully heal, and then after that it begins a very long physical therapy and rehabilitation process.
Dr. Seidenstein, when you're looking at, the bones versus the muscle tissue and the, is it like, not arteries, but like the blood vessels, the blood vessels, what is the greater concern for a doctor? Is it that the bone is going to heal correctly, or is it the trauma to the muscle tissue and blood vessels and things like that?
It's a great question, Maggie, and it's really everything involved. The bones themselves, again, the most emergent thing that we're dealing with is just trying to prevent infection, so getting the patient the appropriate intravenous antibiotics, making sure they're up to date on their tetanus booster shots, and washing out the wounds so that we can get out all the debris. And if it's not too contaminated, which has to be my guess in this case, then you can actually definitively treat the fractures themselves. But there's a whole team of physicians involved here as well. At times, vascular surgeons and plastic surgeons, if the soft tissues are injured enough here. And again, I don't know if that's the case. But obviously, this was such a high-energy mechanism that they had to release the amount of swelling from the soft tissues and do what's called fasciotomies, because if you don't do that, the amount of swelling can compress the blood vessels and the nerves, providing permanent damage to the leg.
Doc, if everything goes well, I know every injury is a little bit different, but if everything goes well, could you see Tiger Woods playing golf again?
I definitely don't want to rule out that possibility, but this is going to involve a long rehab process. We're talking at the very least 9 months to a year before you'll even begin to know the answers to those questions.
How long could he be in the hospital for?
It really depends on what the further treatment will entail. He will most likely be at the hospital at the very least until the swelling goes down enough that they can close the fasciotomies, the releases of the soft tissues that they did. It will also be dictated by the fact as to whether or not they want to take him back even just for another washout of the wounds, again, to make sure that he does not become infected due to the open fracture. But my guess would be anywhere from several days to a week.
Doc, I want to ask you about because we asked you about the compound fracture, the open fracture of his leg, fibia and tibia, and he had rods inserted there. What about the ankle fracture where he had a plate and screws inserted into his ankle?
Yes, and so each of these injuries are severe enough on their own. So the tibia fracture is a little bit more concerning because that bone doesn't have a lot of soft tissue around it, and so those fractures can take longer to heal. In regards to the ankle, we're more concerned with the fact that it involves a joint, and whenever a fracture involves a joint, you're a little bit more concerned about post-traumatic arthritis. That being said, it does sound as though definitive fracture fixation was done in both of these fractures. The only thing that may still need to be done in regards to the ankle is that the pins usually aren't permanent, and at some point they need to be pulled out, but that could be done in the office as an outpatient procedure.
Doc, is this now the assessment of the leg? Obviously, first and foremost, he's just coming off of a back surgery as well. Is that something where down the line it's going to get further assessment too, because he was coming back and recovering from that?
Absolutely. Again, everything is related to everything. But in this case, I still think that he'll be normally treated for his back, and this won't affect it. Obviously, when you are recovering from multiple injuries / surgeries, the recovery can be affected. But I do think that this will not affect the ultimate treatment of his back.
Dr. Seidenstein, is the rod that they put in his leg now, is that going to be there permanently, or is that something that can be removed once he's healed up?
It's something that can be removed, but usually these modes of fixation, whether it be the rod in his tibia or the plate and screws in his ankle, are left permanently unless they irritate the soft tissues later on down the road. The only portion of the fixation that will probably be removed at some point, and again, I'm speculating here, I don't know exactly what was done, are the pins that were placed in the fractures in the ankle.
So right now, Doc, just to recap, you would imagine that there conceivably might be another surgery here for Tiger Woods, and after that he's looking at 9 to 12 months of rehab in order before he can ever think about playing golf again, correct?
Yes, agreed.
Great. Dr. Ari Seidenstein, thank you so much for joining us, for lending us your expertise. We appreciate it. And thank you, and have a good Wednesday.
Thank you, Maggie Moose. Thanks for having me. Take care.
Thank you, Doc.
Dr. Ari Seidenstein from Rothman Orthopaedics. To learn more about Rothman's New Jersey locations, go to rothmannj.com.